All right, you have knee pain and you are busy. Here are some 60-second fixes you can do throughout the day.
That's a good deal, Bob.
Mm,
60
all
seconds
right,
throughout the day,
who doesn't
five for,
have a minute?
yeah.
Bob and Brad, the two most famous physical therapists on the internet.
All right, the first one, you're going to strengthen the quad of
Sure.
the knee because that's the muscle that tends to get weak when you have a painful knee.
You're right.
So you get a pillow, like a throw pillow or fold the pillow in half.
Mm-hmm.
You put it under your knee and you're going to squeeze down for 6 seconds.
6, not
Yep,
60.
6.
Yeah.
And do it times 10. That,
Squeeze 1,001, 1,002, etc., etc.
right.
Keep the heel down on the bed, flatten the leg out, work those quads.
Do it for a couple weeks. You'll notice the difference.
Oh, yeah. It's a nice when you have knee pain because it's non-weight bearing, but we're still working against some resistance being the pillow.
It's copacetic.
Oh, yeah.
Yeah, big word.
Ooh, the big. Is that like Copenhagen?
No. Brad, if you are lacking knee bending or knee straightening, you want to restore those.
Sure.
It will help lessen your pain. So for knee bending, you just slide a little bit forward in your chair
Mm-hmm.
and actually grab onto the knee and pressure, grab below the knee, I should
Okay.
say. Pressure on, pressure off.
Like so you can do it. This is one time we allow poor posture seated.
Right,
You can actually lean back and round your back with. We're working on the knee. It's not going to take very long. About 10 reps.
right. About a minute.
Now, some people may have problems grabbing the knee. You could, wrap around a pillow around there. Actually, this works pretty good.
That's a,
Wow.
or a
Usually
towel
we use a
or a
towel or a
belt.
belt.
Right.
But I like this better. It feels better on my knee. We invented a new one right on
Okay,
stage.
why don't you show the straightening up
Yeah.
now, Brad?
So again, on the edge of the table, chair. Yeah, thank you. Chair, slide the foot out, and it works well if you're on a smooth floor with a sock, so you can get a little slide. But above the kneecap, hands here, and just put some pressure down. And again, with this one, you can do it 5 to 10 times, but try to rotate the toe out if you can see that, and push. Sometimes that will
Feels
help.
better.
Yep.
Right.
Or in.
Go by what feels better.
Yep, whichever one feels best. If you're not sure, work them all, and that'll help. I always tell my patients kind of get the rust out of the knees so that it works into the full range.
Very good. All right, when you have knee pain, Brad, it's really important that you keep it moving because it'll help generate some synovial fluid, which is like an oil for the knee.
Right.
So it also warm up the knee. So like every hour, if you feel so inclined and you purchase a FitGlide, you can do some pedaling or some sliding for at least a minute.
Yep.
Or if you're only having trouble with one knee, you could possibly get by with a knee glide,
Sure.
which I have.
Yep. Now, this is nice because it's non-weight bearing, especially if it hurts when you walk. You're limited walking. This gets that knee moving.
Yeah, it's easy to keep working.
Yep. Put it
One of
under
the
your
place.
desk.
Yep. And want to show the stand, Brad?
Oh yeah, sure. On both of them, they both have a stand
Right.
that goes up.
Mine's up.
It folds under for on the flat, and you can actually flip
Flip
it
it
around.
around for more hamstring.
Right. So you emphasize hamstring versus quad when it's the other direction. It's a very nice option. Particularly, I like the hamstring one.
Right.
But the other one works well too for other reasons. So
They're a beauty.
say no more, Bob. Say no more.
All right, one thing you want to avoid, Brad, is locking your knees when you're standing, especially if we're standing for a long period of time.
Sure.
So let's say I'm at a countertop or I'm do dishes or something like that. You don't want to do this.
So he's
Lock your knees in
got
place.
that knee all the way back. We call that end range, and that puts pressure on the knee, particularly over a period of time.
I used to do this all the time.
Sure.
I had knee pain because of it. So
The other thing that everyone wants to avoid is, or at least you, is showing your legs like that.
right,
That's an
no
issue.
kidding. All right, when we talk about turning out, Brad,
Oh yeah.
your problem.
Yeah, this is my problem. So we're talking about keeping the legs in neutral position. So you can see toes pointed forward ahead would be pretty normal. But if you're out like this, this is I kind of walk like this to it, like a duck. So you want to focus on that and try to keep your toes in. If it hurts to bring them in and it doesn't to go out,
Right. I would.
you
I would
want to
stay
be
out.
comfortable, but
Right.
it's something to be aware of. Okay. I guess the same thing is true as if some people have
Right.
internally rotated feet. So
If
look
it's a habit, change it.
yep,
If it's genetic, leave it.
right.
All right, Brett, I have found throughout my years in therapy that
Yes.
this really helps most people with knee pain.
Yes.
So we have them temporarily use a cane at home. So they are not in public,
Right.
but it helps decrease the pressure on the knee and the knee can calm down.
So what he's saying, a lot of people just don't want to be seen with a
Right.
cane. If you don't mind being seen with a cane, which is a good, you can use it in public.
Right, all
And
day long.
Again, you're only using it while the knee is flared up. Take the pressure off when you walk by using a cane, and it's going to help speed up that recovery process so it does feel better.
Yeah, the key word is temporarily.
Right, right. And make sure the cane's adjusted right and you walk properly with it, which we do have a video on how to walk
Right.
and adjust a cane.
We have a video on everything
Yeah, we pretty much cover every spectrum.
of life.
That's right.
All right, that was some of our hints for decreasing the pain in your knee. Brad, if they have any comments, go ahead and put them below.
Right.
We-
And just remember, you don't need to do all of these. Go through them, find out the
Right.
ones that you'll find that are going to
helpful.
be beneficial, and focus on maybe one or two of them, which can make a humongous difference.
Very good.
Is humongous?
Have a great
technically
day.
Right? Yeah. Yeah. Have a good day.
Yeah, I
we'll,
like humongous.
we'll discuss this later.
All right.